who are the people most responsible for the Medicare fraud that goes on? Well, Medicare is, as you know, is a system that's set up to reimburse healthcare providers for care that they provide. And there's businesses that are set up solely for the purpose of billing Medicare in order to generate revenue. So most of the time, the perpetrators of the fraud, or the people that have the financial interest in the business of providing the care. So most of the time, you're going to have the owners. The owners dictate to the personnel how to go about billing for the services, how to go about coding certain things in order to maximize the reimbursement rates for Medicare. So one example would be there's instances where Medicare requires physicians to provide certain services in order to get reimbursed for that service. A lot of times these services that Medicare requires the physicians to provide can actually be done by a nurse or somebody who has a lot of experience in providing that particular service. So there's been instances where the biller for the services will code as if the doctor was actually there providing the service, but the doctor is really not there and really not ever there. That is Medicare fraud. They would not be getting paid or reimbursed. Medicare has deemed it important for a physician to be providing this service, but a lot of times physician-owned type of businesses really become a business, and it's not about the patient, it's about billing Medicare and trying to generate as much revenue as they can. And if they are only one person, but they can hire 3 nurses at a lower salary than a doctor to provide the same service and bill Medicare, then they generate more revenue, though they're actually not providing the care, which is a requirement in order to get reimbursed.